Hello everyone. Hope you're all doing well. So I want to start off by introducing myself. So my name is Ala Hamid, and I am the head of Alfaisal MedHub. So Alfaisal MedHub is an initiative under the College of Medicine in Alfaisal University based on Riyadh, Saudi Arabia. And what we do is that we basically aim to create an online global community of medical students. And in Alfaisal MedHub, we aim to cover a range of topics that are common to medical students all around the world. And our primary goal is to help these medical students understand their career opportunities and the know-how of the process that surrounds these opportunities. And we mainly do that by the help of our alumni at Alfaisal University. And especially since medical students, they're always confused about what's ahead of them. So Alfaisal MedHub created the Career Guidance Series. And what we do is in the Career Guidance Series is that we basically tackle issues that medical students face through the lens of accomplished seniors from Alfaisal University. So the Career Guidance Series is in partnership with AMBOSS. We're very grateful for AMBOSS's partnership. Additionally, we're also very grateful to Dr. Marwan, who's with us today. He's one of our accomplished alumni from Alfaisal University. And just to introduce Dr. Marwan a bit, he is a PGY1 internal medicine resident at Cleveland Clinic, Ohio. And he will be taking you through the ERAS application process today. So Dr. Marwan, thank you so much for agreeing to give this talk. And you can start whenever you're ready.
Sure, thanks, Ella. Hi, everyone. It's such a pleasure to be here with you guys. In fact, it's an honor. I'm happy to be of any help for everyone. You can just call me Marwan, anyone, and before I start, we've been so used to this virtual setting here, so I'm gonna just show you around what it is like here. I was just talking to Ismail a bit. So this is what my surroundings look right now. It's pretty green and nice outside. This is how it is in Cleveland, Ohio. I'm not trying to, do a lot of advertising for the city, but the city does get a bad rap. It's a nice city. So without further ado, let me try to see if I can share my screen back again.
All right. And if you guys have any questions, make sure to add them to the chat, and Dr. Marwan will answer them all at the end.
Sure. Just to make sure that, do you see my screen?
Yeah, it's clear.
All right. So, ladies and gentlemen, this is your first doctor job application. For the most part, I understand some of you might have done something in the interim, somewhere between medical school and while we're applying to residency. But it's safe to say this is probably your first training job as a doctor, arguably the most important job. So it might not be the best job hopefully it's not going to be the best job you're going to ever have in your career, but it definitely is one of the most important jobs simply because it's going to really determine what's going to come forward. The reason I'm telling you this, I know it's obvious, right? But the reason I'm telling you this is because no matter how overwhelming it gets, how lengthy the process is, it's worth it. This is the most important job you will apply in a lifetime for. I just want to take a moment to appreciate everyone in this room. Irrespective, I don't care where you are in this process. You might be actually applying this year, you might be applying next year, you might not be applying anytime soon. But the fact that you're here, the fact that you are planning your future, planning your present is amazing. So congratulations. I just want to let you know I'm very proud of you. You should be proud of you. Everyone is proud of you, okay? It's a lot of work that you've been putting and you are putting. Another acknowledgement, another reminder, because these are a lot of the times we tend to forget these. These are not things to be sidelined, okay? We tend to be big nerds in medicine. We tend to be very hard on ourselves. This is a tedious process. It can be nerve-wracking for a lot of people. At least for the majority of people, it is nerve-wracking at some point. So we're different, right? Some people can be anxious throughout the process, before it starts, during the application, after the application, waiting for the results. Some people are just anxious in specific parts of it, like waiting for the match outcomes. It's okay. All right. You need to take time, remind yourself what you've done. You've come a very long way. Remind yourself what you've done to get where you are. Okay. Breathe, reflect, remember what's happening. Okay. Don't just, be swamped in the process. Don't get sucked in. It will be okay regardless. So remember, the outcome, I sure did say it's one of the most important jobs in your life, but it's not your only chance. There's always other chances. No matter what happens, it is okay, and it's going to be for a reason. So, by the way, I do want to acknowledge that also some of the people here might be applying for the second time, might be applying for the third time, and that is absolutely okay if you're applying for the fourth time too. Okay, so this is all normal things that happen to the best of us. Um, Although it's important to kind of be cognizant about your future, don't worry about it right now. Focus on the present moment. And a very let's say unpopular opinion, please try to enjoy it. Please try to enjoy the process, because this might be the one and only time you get to apply to the match, and hopefully it is. If it's not, then that's okay too. But enjoy it, right? It's going to be a good memory for your future. I'm going to just go over the outline of my talk real quick. I want you to just focus on a couple of things. I know you've had already 2 talks before by some of my colleagues, I think Omar and Iyad. So I know they did an amazing job. I'm just going to basically put it all together. So we're going to go over why it's important to choose your words wisely in your ERAS application, communication things. I'll give you some quick tips about your personal statement, LOR, some of the other experiences in your CV. And then some underrated VIP sections that no one seems to talk about. Your photo, the hobbies, these are super important. This is the timeline of your ERAS that I got from Alfaisal MedHub. These wonderful guys and girls who are working on all of these seminars for you. So please put this, within your reach. You have to know what's going on. You have to know when is what's going on, right? So I just realized that this goes this way. So you got to go top and then bottom. The most important key dates here is September 29th. Just one quick thing I want to tell you about all of this. It does not matter if you submit on September 1st or September 28th. Okay. I'm sure a majority of you already know this, but just to confirm, okay, don't feel pressure to submit September 1st. You can submit September 29th for if to be fair, as long as it's before 9 a.m. EST. Of course, this is not very recommended, because many people tend to do this, and the servers may experience some lag time. So it's always safe to do 1 day before, 2 days before. I personally submitted 3 minutes before, and it worked. Okay, just letting you know. Okay, so first part, choose your words wisely. So what I'm talking about here is when you are filling out your ERAS application. Okay, please try your best to phrase whatever you're doing, whatever you're putting in, as smartly as possible. Be deliberate. Think about it. Don't just throw in words. Don't just throw in, your experiences. Don't just describe them, and don't throw everything you did. Okay. So there's this nice quote that is, "Words empty as the wind are best left unsaid." Because, again, I'm going to talk about internal medicine, but this applies to pretty much any other specialty. Some programs can receive up to 7,000 applications, and some programs actually do receive 7,000 applications. They're going to put their computer screening filters and things like that. Even if they brought it down to 900 or so, that's still a lot of applications. So pretty much this means it leaves whoever is reviewing your application with maybe a minute or 2, maybe 3, I don't know, to just go over everything. You don't want them to miss the most important stuff, right? Don't dilute. That's what I want to tell you. Do not dilute the overall quality of your application by just filling in with a lot of words, okay? You want them to really appreciate the things that you're most proud of, okay? Also, a pretty common mistake is putting up a passive tone, okay? So remember, this is your application. You're talking about yourself, okay? It is fine to say I. It is fine to use first-person language. It is fine to say to kind of express how you felt about certain experiences in your CV. Okay, by pump it up, what I'm trying to say is, it is okay to, to show off, that this was such a great experience. Even if it was mediocre in your mind, you have to put it up in the best way possible. Of course, with being 100% honest. So honesty is the best policy across the whole thing and in your life, of course, right? So remember, don't say anything that is inaccurate, not true, but it's okay to kind of, pump it up, make it look better. So a little bit about communication. So you're going to receive a lot of communication. You're going to send out some communication. So my best advice would be create a brand new email for the match. And you can do this at any time, by the way. You can do it right now, and you can update your personal email on ERAS. The reason I say this is you don't want to miss out on any single email to kind of get mixed, even if it's your favorite, most serious personal email. I know a lot of us have a couple of emails, and some of them are kind of clutter free. Still, don't use it. Just make a new one. Make a new one that sounds professional. That is very special for this match. So that whatever comes into this email inbox, this has to do with the match. Okay. If I were you, I would probably silence all my other inboxes. Make a very special ringtone for this specific inbox. If there's a filter to basically unfilter, not a filter, a setting to unfilter anything and just put everything in your inbox and not your spam folder, go for it, because you don't want to miss out on anything. A lot of the times, invitations come from there, questions come from there, follow up can go into the spam folder. Okay. Another advice is try to not use your school's domain, right? So you don't want a school address at something.edu, at alfaisal.edu or whatnot, simply because although it looks professional, it's just because that a lot of the time these are monitored by the IT departments of their respective schools, and a lot of the things will be filtered out. Okay, so you don't want that to happen. I do advise you to check your spam on more, your inbox on more than one device, because some devices can synchronize not as quickly as others. I do advise you to check your ERAS messages every single day, at least one time every 24 hours, because believe it or not, some invitations will not show up in your email address. Okay. And trust me, you're not going to figure this out until by chance you see them, like, and you'll be like, wow, there's not even a trail on your email. So check your ERAS messages, and this is rare, but it can happen a couple of times every season. So with a couple of programs, so check it at least one time every day. Okay. And of course, have everything auto log in. And the reason I say, because you might receive an email, when you're driving somewhere, when you're outside, and that email is an invitation indeed, right? Especially if you're living in an other time zone, right? So sometimes you have to confirm that specific invitation on your ERAS, right? So you have to have that login information ready and just hit login and go for it, because time is of essence here. You might lose, some spots in your interviews. How to send communication. It's very important, because I know a lot of you are waiting on some things here and there. You might be waiting for your ECPMG certification, a step score, a publication might come down the road. To be honest, this is the single best excuse for you to reach out to programs and tell them, hey, I have a new step score in. Hey, I have a new publication to take a look. I'm ECFMG certified. You have to be extremely smart with how you phrase the subject line. Okay, the way you phrase the subject line is very important. They might receive a couple of 100 emails every day with just people telling them, "Hey, I'm interested." So please be deliberate in the way you write your subject line. Like, write it clearly. New step, or step 3 score in, and then your last name maybe, and maybe your WAMC number, something like that. Be professional in the way you write your emails. Do not sound desperate, even if you are. You shouldn't be. Okay, you've come a long way, and you've put in a lot of hard work. You deserve, to be invited. Just be, professional. Do not sound desperate. That's not something they like either, right? Another thing is, you can call some programs. I know I'm jumping a couple of steps ahead, but I'm just afraid if I don't get a chance to tell you this later. You can call programs, especially if you're maybe not in the beginning. You don't want to bother them first week, second week, maybe fourth week onward, like 1-2 months down the road. You can make a call, actually, not just email. You can make a call and be like, Hi, my name is so and so. I happen to be very interested in your program because of one or two. Just give one quick reason. They don't really care to hear that specific reason. They just want something to make sense, right? Would you be able to? I haven't heard back from you. Would you be able to take down my double AMC number? And a lot of them, actually, majority of them, if not all of them, will be happy to take the number, right? And that might help. That might help. I've done this a couple of times, and it worked the couple of times I did it. Believe it or not. Okay, I know people who did much more. I think I did it 2 or 3 times and it worked. So for specific programs I was interested in. So the way I used to do it is I'd call and I'd be 100% vigilant. Who's this person picking up the call? Okay. Of course, I do have an idea because I'm calling the program coordinator or manager, and I know his or her name. But sometimes someone else picks. Okay, so be very very ready to hear that name. Remember that name. So someone picks up. Good morning. This is Sarah speaking. So you have to use her name. Okay, make it personable. Make it sound very smart, professional. Sound very nice, kind. Because that's how they're gonna carry on the conversation with you. Okay, and like I said, short and clear. I'm very interested in your program because of one or two. I was wondering, since I haven't heard back from you, if I can drop my double AMC number for you to take a look at it. As simple as that. They'll take it down happily. You can follow up with an email, by the way, right after. That's the smartest thing you can do. Follow up with an email right after. Say, and that email should have been ready already before you called. Thank you for taking my call. That will be in your subject line, because that's going to be a pretty unique subject line. Trust me, I don't think anyone did this or is doing this, or maybe some people did. Anyway, thank you for taking your call. It was a pleasure talking to you, or something like that, right? And then thought I'd write it out for you for your convenience. So my name is Marwan Dabbagh. I'm interested in your program. Brief summary about me: 1, 2, 3, 4 bullet points, short ones. Thank you again for your consideration. Double AMC number, and that's it. One time I got a response to that specific email. So I told you. So personal statement, just a quick thing about every single thing. I'm going to talk about personal statement, LORs, work experience, real quick stuff, okay? I want you to have your personal statement short, sweet, engaging. Now, you're going to hear a lot, okay, of different opinions. That you're going to hear people saying no one's going to read your personal statement. That could be true. People are going to say a personal statement can be a deal breaker for some of programs. That could be true. Believe it or not, sometimes it can actually be a matchmaker too. And I definitely had about 4 interviews, 4 people, 4 different programs mentioning things from my personal statement during my interview. One of them was very clearly said, I really loved your personal statement, and the reason I called you was because of your personal statement. Trust me, that happened. I was very happy because I know I did spend a lot of time and effort, but I was also always wondering, is it even worth it? Okay, so very important that a personal statement can never be written in 1 or 2 sittings. I'm glad you have time now to review it. I would review it maybe 100 times, 30 times, whatever makes you comfortable, on different days, different times. Okay, print it out, read it, print it out again, read it, review it, fix it. It's a work in progress. Okay. Do not rehearse your CV. That's a mistake I initially did, and then I figured out, okay, that's too long. That's not how it should be. I should throw all of that. They have your CV, right? They have your resume. That's not the point of your personal statement. You want to show them the other side of you. You want to show them who you are, maybe where you come from, whatever you want to share with them, right? Important life-changing events, things like that. Don't get too poetic, okay? Because it's just too silly, and that's not the point of this, okay? You have to show off some of your skills, some of your characters, show it off. That's the only chance you get to brag about yourself. Think about it, right? This is literally the only chance it is made for you to talk about yourself. It is made for you to say the good things about yourself, right? No one's going to say bad things about themselves in the personal statement, right? So use this chance appropriately, right? Don't be too corny. Yes, be confident, be humble, but don't sound too humble, too nice, and too pitiful. No, to be confident, know what you're doing, know what you have in. Okay, it might be a good idea to have multiple versions of your personal statement. Some people like to do personal statements for specific programs. So if you have 1 or 2 programs that are super interesting to you that you really care about, you might as well address them, if you want to. I didn't do this, but a lot of people did this, and I don't think it's there. It can harm. It might actually do good, right? Another thing is that many people also talk about, and I agree with, is be careful to not intimidate programs. Okay, so if you're big on research, okay, which I know a lot of you could be, um, you don't want to really, show off a lot of that research or show off the fact that you're interested in a very top-notch competitive subspecialty and put it and send that personal statement to a small community program middle of nowhere, because they might be intimidated just for one reason. A program director, end of the day, wants all their residents to be happy, right? If I'm a program director, I don't want to get a resident who wants the most competitive subspecialty of my training program, and I know deep inside I cannot, fulfill this person's dream, right? I don't want them to come into my program in the first place and have them leave, sad or not, So be careful. Be very careful. You can have two versions: one to send to university programs that are top notch, good on research, good on fellowship. They have great fellowship outcomes, and another one that is like a watered down, more easygoing personal statement that is, more general. I talk that you like medicine, you're open, you're keeping an open mind about, further training, things like that. That's not to say you're lying, but it's just that, since they are your backup programs, I assume you do have some backup options, right, after you graduate. So keep that in mind too. So that's a smart point when you're doing maybe two personal statements. Okay, for letters of recommendation, I know most programs will ask for three. Some of them will be like, it's okay to have a fourth one. It's okay to add. I would, if you have the chance to solicit more than four people for doctors to write you letters of recommendation and upload it for you. That's always a good thing, right? You can only assign 3 to 4, right? But who knows? Some even the letter of recommendation that you banked on the most might not come in time, right? Might never come in, right? You never know. So might as well have 5, have 6 if you have to. Okay, I know some of you barely have one, and that's okay. You have to work your way around things. But if you have the chance to get more than 4, get more than 4. You don't have to assign everything that's on your ERAS. You choose what you want to assign. Okay, so keep that in mind. Of course, everyone knows avoid generic letters of recommendation. My personal opinion, if you're unsure if this particular preceptor you had is going to write you a good letter, is going to write a generic letter, blah blah blah, just don't waive it. Okay, this is subject to debate. But just so you know, the general consensus is, especially IMGs are supposed to waive all their letters, and I'm sure you know this already. But we don't know where this information came from. Okay, you might as well not waive if you're not sure what's in there. You'd rather have it not waived than have a bad letter of recommendation. Just to let you know. Okay, I'll give you a quick story. One of my friends actually did a clinical elective at Harvard, and he worked with an 80-year-old super famous nephrologist. And just because that guy is not very familiar with technology, he actually uploaded an evaluation like literally an evaluation and not a letter of recommendation. And if you're being evaluated at Harvard Medical School, it's not going to be rainbows and roses, right? They're going to put out some of your deficiencies, which everyone has. So although it was an honor rotation, he honored the rotation, right? But there were more negative points for him to actually improve than positive points, and it really costed him bad. It costed him real big money in this during this past season that I participated in. The guy should have had probably triple the number of interviews he got. He should have matched at a place triple how good it is. So I'm just letting you know these things can happen. If you're not 100% sure or almost sure what's going to be put in there, don't waive it. It's okay. Okay. And I spoke about this one. Okay, so work experience. Please be selective on what to include. That's the key, and wording is also key. I'm going to give you some quick examples, and the idea about these examples from this is from what I worked on. Um, it's really just to give you a feel. It's not to not to influence what you're writing. Give you a feel. I want you to just think out of the box, because generally speaking, we don't see many people's ERAS applications, right? So I'm going to give you some examples from my application just for you to think out of the box and see how other people phrase things, okay? Um, so this is a an elective I did at a place. So the way I wrote it, this is work experience. Is so I had the chance. See how I use first language, first person language. I had the chance to interact with this and that in this and that setting. Floor in ICU. See, look at this part. Beyond the bedside, I got to see and learn about the typical coordination of care between various medical and ancillary services, how patients are transitioned within the US healthcare system. At the clinic, I interviewed and examined patients. I observed pulmonary function tests, 6-minute walk tests being done, immediately interpreted results. I practiced a huge deal of reading patients' chest X-rays, CT scans, interpreted a lot of ABGs and labs. So you see, this is in contrast to just being like, hey, I attended a clinical rotation. It's 4 weeks long. Worked with this doctor, attended the rounds, attended the morning reports, attended the clinic, wrote notes. So if you do this, guess what? Everyone is doing this. That's exactly the definition of an elective or an externship or whatever, right? So nothing is special there. Nothing really is special. You have to give it a twist, okay? You have to give it some kind of a twist, okay? Beyond the bedside, I did this and that. I interpreted this and that. I worked in these. I attended some symposia. Okay, that's what makes it special. Okay, this is just one person's opinion, right? So do whatever suits you. Another thing here is some work experience I did at Johns Hopkins. So look at I do have some variety in the way I lay things out, just in order for me to make it as clear as possible. So for example, here I said I took permission to join the clerkship rotation with blah and blah. I attended this specific thing, so flipped classroom sessions, professional skills sessions, noon conference. This is just for me to kind of reflect that I've worked in different settings. Okay, rotated in these specific places, and then I added one thing here. So basically, I learned how a U.S. model healthcare system functions at a top rank institute like Hopkins was invaluable for me. Okay. Another example was notice. So it's the exact same it's the exact same institute. Okay. Different dates. Essentially, it's the same period of time, but it's a different date, and it's a different thing that I did there. So I was a student facilitator for interprofessional education sessions. So sometimes if something you want to highlight and it's pretty much the same experience, but it was a big experience, it's okay to break it down, in order to kind of highlight it more. So I explained how I was a visiting student. I had the opportunity to facilitate 2 interprofessional sessions. So that's like a teaching kind of experience I had. Okay. So I taught students from this place, from medicine, nursing, pharmacy, and then I had the chance to work with 2 groups, blah, blah, blah. I was responsible to lead the 8 semester. So sometimes, it's important. You can break things down. That's what I was trying to show you here. Okay. And then that's another example of a clinical externship. So this is also a tip on how to use your wording wisely. Okay. So remember, you can say this was an observership. You can say this was an externship. You can say this was so just try to make it sound as in the best form possible. Okay. So if you say clinical extern, I think it sounds better than just saying an observer, especially if there was some hands-on involved. Okay. So sometimes you can also talk about things you were involved in besides just the writing notes and rounding and blah, blah, blah. So look at this. I was present and involved in the process of breaking bad news to some patients with new, recurrent, or metastatic disease. Again, this was because it was a HEMONC experience. During downtime, I had the time to populate our patients' charts on the clinic's EMR, review and co-signed by Dr. So-and-so. I would present one of my assigned topics twice a week in front of doctor and the team. Okay, so you get the point now, right? Moreover, let's see. Okay, so this is for some of you. I know some of you might actually have done or is doing some tele-rotations at this point, at this time. So just because a lot of you have been asking this, yes, they are valuable. They're better than nothing. It's a U.S. letter of recommendation that you're going to get. Just again, word it wisely, right? So look at this: clinical trainee, advanced internal medicine rotation. Now, I didn't come up with this, right? We spoke it over with the preceptor, and we're like, okay, what are we going to call it? And then we actually thought amongst ourselves, me and the other students who were rotating at that specific tele-rotation. So I was one of the people who did one of these. And this is what we came up with, It's better than saying tele-rotation or something like that. Clinical trainee advanced internal medicine tele-rotation. So this was a 4-week internal medicine tele-rotation, originally intended to be hands-on, but converted to virtual due to the ongoing pandemic, which is true. Okay, so put it out there. That shows that, okay, this was not the original intention, but you're kind of being flexible and going with the flow and things like that. Comprised of clinical case-based group discussions, followed by extensive investigation, management, planning of care, etc. Remember, this was not a hands-on thing, right? But look how it sounds. Look how I'm putting it out there. It's all true. We're not lying in it. Okay, that's number one rule. Honesty is the best policy, right? Comprised of clinical case-based group discussions, followed by extensive investigation and management planning for each case with supporting literature as appropriate. That's what we're doing. Got formal EMR training every Friday. That's something that program was specifically offering. Had the chance to participate in the virtual sim lab at blah 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 and blah blah blah. I had to demonstrate my real life. Look at this. This is the reason I put this here, to show you how I'm using first person, right? I'm not reporting someone else's work. I'm reporting my own work. So I had to demonstrate my real life response to common emergency cases, including codes, COPD exacerbations, anaphylaxis. Again, I'm referring back to the sim lab, where I worked within a team and other MDs, nurses, and students. I learned most through our daily EBM review sessions of the landmark published randomized controlled trial studies, management of this, and that. Okay, so this is kind of how you want to phrase things. Maybe you can even do a better job than this, to be honest. So a lot of the time I look at these things and I'm like, oh, I wish I did this. I wish I fixed that. Okay. Okay, I put some out of the box things, examples from my CV, where, for instance, it doesn't always have to be pure medicine research electives. There are things that you have done or probably did or doing that is pertinent, important, reasonable, useful. Remember, a lot of the US MDs who are applying have a lot of experience before medical school, right? A lot of them have. So that could be working as a piano teacher. Most of us didn't, right? So we have to have something that is also somewhat interesting. So I have a couple of examples. I don't remember how many examples I put here. So this is something I did. I worked with the Girl Scouts in San Diego in California. So I basically was a licensed instructor of basic life support and advanced care life support, and I had the chance to get employed there and work there for a while. So that's what I said. I got hired by them, and basically to teach these skills to adult volunteers and troop leaders. So basically, not the little girls I was working with. I was working with the adults who went out with them to protect them, right? And then I explained what is the credentials I got and what I was allowed to teach. And while this experience is new to me, I find training laypersons equally rewarding and more challenging. So initially, I was trying to explain up there that I was used to teaching healthcare professionals, like physicians and nurses and whatnot, okay, and students. But now I'm teaching laypersons, and I kind of gave my reflection point on it, okay? Another one is the American Heart Association international training site that we established at Alfaisal University. So that is something that I'm very proud of. So I made sure I put it on my work experience on ERAS as well, right? And this is you can get creative on what you name yourself. Look at that one there. Health curriculum instructor, that's the previous one at the Girl Scouts. Health curriculum instructor, part-time. Okay, that was exactly my job position. Over here, I named myself training and site co-founder, former lead instructor, and current senior advisor. So I think that's too long. Looking in retrospect, I think it's a little stupid. I would have fixed it. But anyway, the idea here, you can be a little, smart about how you phrase these things, make it sound nice and good, which it probably is. You can highlight a couple of good things, especially like if you had got an award, if you had some. Look at this. We went on community health campaigns at local malls, festivals to educate the public. things like that. It says somewhere here that I trained maybe more than 100 students here. So I trained and licensed more than 100 students and faculty from my school, in addition to nurses and doctors from our teaching hospital. So you can kind of, show off a little bit, okay? And you can also be personal and reflect. So see, I love teaching, so I later worked on becoming an advanced cardiac life support instructor. So I kind of showed the transition from BLS, being a BLS instructor to an ACLS instructor and things like that. It's okay. It does not have to be like a very serious, dry bone conversation, right? It's a human being that's writing this, right? And it's a human being that's reading this. Okay, let's see another one. This is another piece of work that I was working on, that I worked on and do. So you can again think about other things you did outside Alfaisal, outside your medical school, outside medicine. And that's okay. So here I was a junior reviewer. So I'd review manuscripts of people who want some help, in either, look at these. So I lay it down. So, look, so my layout, my format can be different from one to one, when sometimes it's a little paragraph, it's a little paragraph. Sometimes if I want to lay it out and still make it look good to the eye, I would do this, okay? So these were, depending on client requests, I specifically do one or more of the following, and I explained linguistic review, technical issues, formatting, fact checking. And then I give them an idea, why did I do something like this? So I use a job mainly as a motive to sharpen my own research skills, and also as a means to make extra pocket money whenever I was relatively free to take a project. You see that right there? Now, I'm not saying this is 100% the right thing to do, or you should do it, or I'm just saying that I thought it's, again, I've heard, also advice from other people that it's okay to be personable. It's okay to kind of reflect and show your ideas behind it. Okay. And then I go on to say, I like this work experience as I learn a lot, allows me ample time to review each project, about 10 days. So I was able to do it at my own pace, bit by bit every day, without affecting more important tasks like studying and hospital duties. I don't know. I had to sneak this in just so that people don't think, what is this guy doing? He's not doing what he's supposed to do in medical school. I don't know. Just thought. And then reason for leaving, just so you know, most of the times we keep this blank. Okay, you don't have to find a reason for leaving every single time. I just put this here in the screenshot because this was one of the very few that I filled out. Most of the time, this is blank. This is the best part about ERAS. It's not like you have a lot of must fill, fields. A lot of them you can just keep it empty. Reason for leaving a clinical elective or whatever, it's over. You don't have to write because it was over. Just keep it blank. Okay. So what about this one? So that's another one. I'm just, again, the only reason I'm showing you these is just to kind of give you an idea to think out of the box. It might remind you of some experiences you worked on. It might give you an idea about what you should be thinking about and how you can be phrasing things. So this is an example where I directed and actually established one of the summer enrichment programs at Alfaisal University. It's called Direct Admission Orientation Program. So I want to show you how I showed them my thought process, okay? So as a medical student, I witnessed how some of my peers struggled with adapting to new university environment and passing first year courses. Our school followed a British system, MBBS, so we did not have the usual American pre-med to MCAT to med school. Again, you're talking to an American audience here, right? You have to make sure things make sense to them. You can't just throw in the word internship here and they'll automatically understand that's your last year of medical school. So it's got to be called final year of medical school. And again, here, you see, I'm using their words, rising second year medical student. That means they're automatically understanding I'm going from my first to my second. I'm trying to tell them it's not the usual American pre-med MCAT med school transition. Okay, because it might be very foreign to them. How come people are jumping from high school, right? And that was exactly why I'm trying to explain here. I realized that there needs to be a bridge to fill the gap. That's why I created a summer pre-matriculation enrichment program, drafted a syllabus proposal, discussed it with our deans who applauded the idea. So all of this also shows them, your thought process, shows them what you did, not just, I established it. Okay, I drafted a syllabus. That's a big deal for them, right? Probably. I worked on all the necessary logistics aspect. Again, this is showing them how, it's all deliberate why I'm putting these things. Because it's showing them, okay, this guy can do some logistical work, can not just study and do work and get good scores on exams and boards. I did some budgeting, gave them an idea about how much budget we were worked with. had the opportunity to also teach. So that's probably the most important part about all of this, right? They appreciate people who are teachers who like academia. Um, and then I told them what exactly I was teaching. All right, so moving on from work experience, that was just a couple of examples. I hope it was beneficial. I have much fewer examples on research and volunteering. So for research experience, if you have many, again, select the most fruitful ones. If you've done, I know a lot of us were blessed at Alfaisal University. We actually had a lot of, research exposure. For people from other universities, you might have also had some varied amounts. So just be smart on what you're picking. If you have nothing, that's also okay. By the way, they're not recruiting researchers; they're recruiting clinicians. Okay, they do expect you to work on some research later on. It's absolutely fine to have nothing. But something is better than nothing. So try to remember, squeeze your mind. Have you helped with distributing surveys at some time in your life? I'm pretty sure you did, right? Somehow, okay? So put it in as some kind of experience. You don't have to be a published author or anything to fill out something here, right? Have you taken a course maybe in research sometime, attended some webinar? Put it there. You don't leave it empty. But I'm not just saying fill it with anything, fill it with something that's useful. Some examples of research experience, okay? Again, if you notice, that's the same, pretty much similar experience, but I want to highlight, but I put it up here because I never spoke about it as a research experience in the past two entries, but this is a pure research experience that I'm putting here, okay? And again, pump yourself up, give yourself the credit. So I was competitively selected among 300 applicants by a committee based on curricular, extracurricular accomplishment. At least that's what they told me. So put it in there, show it off, okay? You get it. This is your only chance to show off a little bit. So it's okay. I know it's not humble to do this, but it's okay. Don't worry. Um, so then explain that you were sent on a scholarship because they funded you somehow. They gave you some money to go there, right? That is a big deal in American terms, right? I had the opportunity to work with Dr. So and so for blah, 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 and kind of outline the projects. Then if you had look at this. I participated in meetings, collaborative projects, other universities like UPenn, Wake Forest. So again, this interinstitutional collaboration. These are big things. They care about these things. So put it in there as well. Okay, show off the most important things. I joined the library courses, 15 research classes, worked with a clinical informationist, helped me develop professional PubMed search strategy. Things like this will give them an idea. Okay, this guy, if we furnish him or her with whatever they need to be productive, to do research, they've had some experience, so they know how to work with these resources. That's the idea. That's the point. Another example. So I don't know if some of you have heard about or participated in SIMEC, the Saudi International Medical Education Conference. Any conference, doesn't matter. Okay, so I was very lucky to be chosen as a co-chair of the student panel session. So I have to put it in there, right? Where am I going to put it? Volunteer, maybe. I could have put it in volunteer. Work experience, I don't know. So sometimes you don't know where to put things. Okay. I just figured since this was a research conference, for the most part, medical education research conference, put it in your research experience. Um, make it show it off somewhere, sometime there. Okay, moving on. Volunteer experience. Again, I want you to choose the most impactful ones. And now this is the most difficult one because we tend to forget, what we did, what we volunteered. So you need to brainstorm and try to remember the most impactful ones, sometimes the most goofy ones. Trust me, sometimes you might want to, throw in one or two funky ones because they're interesting. So I'll give you an example. I think um, I had one of my volunteering experiences that had to do with Movember. And for those of you who don't know, it's essentially, how November is the prostate awareness month. So mustache with November is Movember. So there was this event going on in King Faisal Specialist Hospital where we had to grow, mustaches and make it nice or stick on something and then wear I think some jackets or vests that said Movember at the back, go around in waiting rooms and hallways and educate patients and random people about prostate cancer. Okay. Believe it or not, a couple of interviewers specifically left the whole application and asked me about that because they found it cool, you know. And you know what was cooler? I immediately pulled it up on my phone. I'm like, hey, can I show you? So they're like, yeah, of course, please show it. So I did show them a very, very badass picture of me having like a nice big mustache and cool retro glasses. So I don't think that's something they can forget, right? Because again, they probably are seeing 500 people, 600 people. So depending on how big the program is, how much they want to interview. So just remember, sometimes you want to think out of the box, brainstorm, remember some of the interesting experiences, and again, make it glow. Don't just put it, oh, I participated in November, but yeah, what did you do there? You talk about things that you did there. I don't know if I put that experience somewhere down here. Um, Probably not. Okay. So okay, another some examples of volunteer experiences also, again, if you worked at some communities, okay, the way you word it, use their own terminology, okay? Look at this. Nonprofit. These are big buzz terms. Nonprofit, local community service initiative, okay? Very, very impactful terms, okay? Again, they should be true. Um, some patented software, whatever, that doesn't matter. Okay, clinical screenings. Okay, so you're working with your community to advance their health and preventive medicine. Okay, that's a big deal, right? Um, so you can again talk about your progression. I started as a volunteer team leader, and then I became a member on the board of directors. I trained volunteers. That's a big deal if you train people. Okay, mostly junior medical students and college students on how to take concise medical and social history. This is also important. We reassured patients that we're here to help. So that shows your interpersonal skills, right? Attempted to screen for serious health issues, promoted health awareness as appropriate. So healthcare promotion. Again, buzz terms. Try to put as many applicable buzz terms as possible. Okay. Um, and then another example would be, okay, so this is a very interesting example also. I'm glad that I included here. So again, think about other things. So here I volunteered as a math tutor. I want to show you about the way I phrased it. I signed up as a volunteer math tutor during 2019 academic year, fall semester, quarterly exam sessions. It was a refreshing experience for me as I got the chance to work with the younger men and women who attended school in my own neighborhood. I live a few blocks away from San Diego Community College, blah, blah, blah. I love teaching, but I always thought folks around my age, academic scope in medicine. So um, again, showing them that I'm doing something now outside my normal scope. This opportunity was quite unique in that sense, made me appreciate the challenges younger people go through in a typical large American metropolitan city and learn about different careers I hadn't known much about. Okay, so I'm teaching, I'm learning, I'm interacting with other age groups, I'm all these things. That's okay. And then appreciate, respect, the gratitude, blah blah blah. So you get the point, right? Another thing. Okay, what if you're not really near a college? You're not even in America. You don't have these kind of things. Did you do something virtually? Did you try to do something virtually? Can you do something virtually now? Probably yes, right? So again, be creative. I furnished myself the chance to relive my tutoring passion again as a hobby. Okay, I know that's a little too poetic, but it's okay sometimes, okay? As a hobby and part-time job during COVID-19 pandemic lockdown, it served as a fulfilling utilization of my time. I taught my favorite course, the USMLE. I'm kind of lying here. To the US medical students and foreign doctors who believed they needed some additional help, blah, blah, blah. And then look at this. You have to add in some flavor of whatever is happening around, right? So there was this pandemic, right? So due to the virtual nature of these sessions, I use a Wacom Into Us, which is a pen digital input device. Make it sound fancy, to project my illustrations and sketches in real time onto a virtual on-screen whiteboard. It took me a while to come up with this statement, right? It's not written anywhere else. So also using webcams for video conferencing to make the sessions as real as they can get. So again, showing how you can adapt with changing situations, showing that, oh, you're so passionate about teaching. Again, all of these are true, but the way you twist it makes the biggest difference. Okay. I'll give you one last example. So again, volunteering, they love, charity. Everyone loves charity, right? So, and I'm sure everyone did or is doing some kind of charity at some time. So remember that. Try to brainstorm. That's why I'm saying brainstorm the little things, and maybe some little things are more important than the big things that you spend way more time on. Okay, put it in there. So again, here I worked with the Salvation Army, emergency food distribution. So during the ongoing pandemic, rising unemployment rates, there was growing emergency need for emergency food. Again, I'm using the flavor of the current situation, because you can't ignore the elephant in the room, right? There's something going on. What did you do during the pandemic? So I was dedicating a few hours, 3 days a week, to this food bank specifically that serves this specific area of the specific city. Okay, I got the chance to work with many other local volunteers. Again, this is teamwork to package arrange foods for the in the pantry. So again, this is something outside medicine. This is charity. This is teamwork. This is exposure, etc. Okay, you're risking yourself, putting yourself out there. Entails verifying this is what I was doing, showing them, okay, it's not just medicine that I do. Moreover, I created translation document, Arabic guide sheet for the crew to use when I'm not around. That's also showing them how you can do things. Um, Sorry, this is the last one actually. The reason I really want to talk about this because I had one or two people specifically ask me, "Oh, you did a lot of interesting stuff. You had such a well-rounded CV. You did things that have to pertain with the Girl Scouts, things that have to pertain with breast cancer, blah blah blah." So they did mention these particular things. Again, it's the zebras that catch their attentions a lot of the times. Okay, everyone's application is full of horses. Sometimes the zebras are the most catchy. So if you're just scrolling in through and see something like many shades of pink, what the hell is it? So they want to read that probably. So this was a fashion show, okay, celebrating or honoring breast cancer survivors. They were literally going on a what do you call it? On a runway, I think it's called a runway. So the event honored breast cancer survivors, etc. My sister and I volunteered. So we might have actually add a friend there, a sibling. That's fine, Just be open, be cool about it. The event served as a fundraiser, so that's a big deal, right? That's a big buzz term, and it's important to show off that or show it up in your application. So you actually worked for a specific cause. During the event, we welcomed guests at the door and guided them to their assigned tables. So ushering, as simple and silly as this, a high school student can do it, but it's okay. You're that humble. You have that humility. Everyone had the opportunity to participate in the silent auction. Again, we're talking about the fundraiser, right? Giveaways. And look at this. You have to add your touch, right? What did it mean to you? Okay, you're not just rehearsing because you'll find most of this on the online description of this. But what did it mean to you? It was a beautiful, enlightening experience for me to help and experience firsthand such an amazing cancer support group function. So again, gives that personal touch for if they actually read this, they'll be more interested too. Um, Look at you. Call you. So last 2 points, almost done. Your professional portrait. It's probably one of the most underrated things. Trust me. This is the real first impression they're going to get. So a lot of programs are working on just blinding pictures and not looking at them in order to not have any bias, and I think that's great. But probably most of them are not doing it yet. Anyway, for those that are not doing it yet, I'm not asking you to be a Brad Pitt or a Megan Fox. Trust me. All I'm saying is you have to look your best, your absolute best. If you have a nice, better left side profile than a right one, do it. If you have the specific tie or the specific blouse for girls or whatever, do it. Come in your best, most well groomed way, not the way I'm here in front of you. Your best outfit, things like that. You want to actually spend some time and money and thought into it. Okay, go get a professional picture done. And if you don't like it, do another one. Okay, you have time now. Okay, literally do another one. It's okay because a lot of the times this is where they're going to put a face onto the application, and this is so important, way more important than you think. Please smile. It's not a passport photo. It's not a formal picture. It is formal, sure, but it's not a very official government document, right? So smile, show some teeth, good lighting, good clothes, good grooming, everything. Okay. Again, pay attention to this part. Your hobbies, probably one of the other underrated things. You have to word it very nicely. Don't sound boring. This is the single place in your application, maybe apart from the personal statement, to be interesting. So you can be interesting across. Okay, your application, but here you get a chance to kind of break free and go wild if you want to. Don't fake it. Don't make a fool out of yourself. Honesty is the best policy. Don't say that you're a world elite Olympic swimmer when you're not. Okay. Don't say even more serious things where, because the interviewer can be whatever you're claiming to be, and they can ask you, and then you're not going to look good. Okay. So again, don't lie, never lie in anything. I'll give you an example of how I think this was one of my drafts. I'm not sure if, so again, I kind of tried to think, again, space is limited. I said I enjoy fishing, horsemanship, and strumming the guitar, perhaps why I'm so fond of country music. So here I threw in a lot of things together, you know, these three things has to do with country music. Okay, I gave them a lot of things in just one short sentence. I have a thing for American German cars, of course, taking them on road trips. Again, I showed them my interest in cars, my interest in going on trips, traveling, whatever. My favorite hobby is, so all of this is not even my favorite hobby, right? So again, I was just trying to work on the transitions, right? I want to throw in a lot of things without sounding like, oh, I'm just listing. So my favorite hobby is visiting new places, meeting new people, learning about the culture and language, which many think I'm gifted at. I do try. So here's this little silly joke. I'm a coffee person, and that's true. I bask in the glory of a good cup of plain espresso Americano every day like it's a new adventure. Bonus if it's with good company, view, and weather. Okay, so notice I've actually thrown in almost 500 million things. So look at fishing, horsemanship, strumming the guitar, music, cars, road trips, visiting new places, languages, people, coffee. That's 10, literally, right? So don't list. I could have just listed them: 1, 2, 3, 4, 5. Spend some time here, review it, fix it, change it, read it in different days, read it on different times, read it when you're sitting, read it when you're laying down, read it when you're standing upside down. Just keep doing it, and print it out, get a pencil, fix it. By the way, the hobby section is one, I really think it's safe to say it's one of the sections that is very much visited on your application, simply because people would wanna, the rest of the application is super long, right? And when you're scrolling down real quick, they'll pause in specific areas. But the hobby is interesting, really. I wanna see if I'm reading like 100 applications at a time. I'll just pause there and see what is this guy, what is this girl like, what do they sound like? Okay, so that's one. Two, right before I interview you or whoever, not me, of course, the program director wants to interview you, what are they going to talk about, right? They're meeting you for the first time. They have 10, 15 minutes to talk about, they want to break some ice. So they're going to, okay, well, let me look at their hobbies. Let me start a conversation. A lot of them actually will look here like, oh, I hear you like coffee. What kind of coffee do you like, So this is what they're going to talk about. This is what they're going to ask you. So be sure to be very deliberate in the way you phrase and write your hobbies. It's really helpful for you and for them, okay? A lot of the times I'll laugh when they ask me about the coffee and be like, hey, mind if I show you a quick secret right there? So I'll pull up my coffee from right behind the screen. So anyway, so do have something prepared. So if they ask you, oh, you're a coffee person, what is that? Like, what kind of coffee do you? So have something in mind, like 30 seconds or a minute to talk about your favorite coffee beans, that you grind them on your own. You have this Hamilton Beach machine. This is how you do your espresso, blah, blah, blah. Something like that. The last thing I think is about, this is my last slide. So about your medical school awards, honors, that's another thing they care about. So especially good programs tend to wanna, grab people who have some kind of track record of some honors awards, because they think that chances are this person is gonna, continue to be good. Okay. So some examples: if you're a Dean's List student, put it there. If you've gotten some merit-based scholarship to be admitted anywhere, put it there. If you got some award, if you got some award, not necessarily just in medicine, right? So if you went to some math competition, something, cooking competition, art competition, please put it there. That shows them another aspect of who you are. And that's pretty standard here, and in the United States, a lot of people are good basketball players, college football, whatever it is. So keep that in mind. That's your competition. Competition are good, well-rounded, interesting people as well. So you better show off that you are the same. So unfortunately, the reason I put this here, because I want to say, unfortunately, we do not have these professional societies in most of our schools, and probably all the international schools outside the United States. So we're already at some form of disadvantage. I hate to end this point, but we have some disadvantage, okay? So you want to kind of override it with a couple of things that you can show off. Again, space is limited. So pick the most important things, biggest things, and put it there. Okay. I think I might have, I hope I'm still on time. And I definitely wanted to leave some time for, for some time for some questions to see if, okay, perfect. Let's see. Um, Can you share how you obtained the clinical research electives at Johns Hopkins, Methodist, etc.? Did you apply through foreign programs? Yeah, absolutely. So for the research elective at Johns Hopkins, this was actually through Alfaisal University. So that's through my medical school. I think a lot of you guys are from Alfaisal. So that was through Spirit, just to put it. So usually but just to let you know, they do have an application online where you can apply to their research elective online, and they do have a currently telerotation in neurology clerkship. Just look up Rachel Salas on Twitter. Okay, it's Dr. Rachel Salas. So that's the. I think she has some virtual experience. I'm gonna type her name here, Rachel Salas. She has some kind of, oh, I think that was I'm going to put it to everyone. So that's one specific example where she does some virtual rotation and whatnot. Um, and then for the Methodists, I actually went there in person and spoke to a clinician there. Literally, I didn't know him. I went there with a friend. We both asked, and he was like, "Okay, please take a seat. Where do you come from? Where do you come from? What are you doing? Why you want to do this? Sure, join me on Monday. Sometimes you just need some courage, and it'll happen." Khalid Abdullah is saying, if, for example, published three researches, contributed heavily in writing data collection, should you add them as three separate research experiences? If not, won't it look weird to have an application with three publications but no research experience? Um, no, I mean, it wouldn't. It's fine. See, to be honest, there's no right answer to this question. It's really how you want to present. So, if you feel your application is not too long and you can, put up more things, show things, it's fine. Okay, it's fine to put it in different multiple places. If you feel no, your application is already too long, I might as well avoid any kind of redundancy. Just avoid redundancy. That's the best way to go. Okay. So Noor is saying, would an extensive research experience make up for barely any work experience? Um, so the thing is, they're not interchangeable things, but let me tell you this. I'm pretty sure you have work experience. My take home message would be brainstorm. Just sit down, think about it. What did you do? Okay. Were you involved in anything related to the MSA? Anything in your batch local committee? Anything maybe even in high school? Maybe can you do something now? Yes, you can. Can you do something now? Yes, you can. So think about things to get involved. Okay. Reach out to the MSA, reach out to Ismail. He might help you. People in the MSA might help you to get something done. Okay, that is meaningful. Try to pick something that is meaningful. Okay. Um, how many examples should I include for each experience? I have a lot, but I want to know the maximum. Um, well, there's no maximum, to be honest. But don't see. I made a mistake and made a huge, very long CV, and I think that was not the smartest thing to do. One interviewer low key said, "What the hell were you thinking?" He low key told me that. He's like, "This is the long." He had it printed out. He's like, "This is the longest CV I've ever had seen in my." I swear that's what he said, and I didn't know how to feel about it. But to be fair, for the most part, he was praising, and he said, he was praising everything and on my application, and I don't think he was trying to mock me, but it's not a good idea to list everything. I didn't list everything. Okay, I tried to be picky, but I definitely should have been. I could have been more picky. Okay, but again, this is they say hindsight is always 20/20. So that's why I'm here to give you some advice. Someone else is saying, Stephanie is saying, thank you for this presentation. Can I ask? Okay, so I think that's more of a personal question. Awards on arts, on math before med school can be mentioned. Absolutely, Rawan. I think you definitely should if you have this. If you think you have space and you should make space for it. Mention awards in arts, mention awards in math, because that's what's going to make you stand out. Everyone did clinical rotations, let's be honest. Everyone did some sort of research, maybe, let's be honest. Everyone did some kind of boring volunteering activities, right? So if you did something that is interesting, you had an award in arts, that's amazing. You know, you have to show it off, right? That's probably, you're going to see how a lot of the times your interview will be focused on that. Um, Sajid is saying, in your opinion, how long should the description of work experiences be? Um, Honestly, the shorter the better, to be fair. And I know some of the examples I showed you are not the best examples of short. But trust me, this is the shortest. I tried to make it very short. So I'm just trying to tell you, don't be liberal and make it long and exhaustive. Just make it short, nice, clear, concise. People will appreciate this. Okay, because again, you don't want to dilute it. You want to show off the most important things. Um, should I mention merit scholarship if I lost it? Absolutely, because you had it at some point, right? So you can mention dates if you want to, be like super clear, transparent. Um, but you can say merit-based scholarship on admission, merit-based scholarship during my second year, merit-based scholarship during my third year. That's fine. You know, it doesn't not a scholarship doesn't necessarily have to span your whole education. If it did, that's fantastic. Is it helpful to mention that I am part of the ACP? Yeah, depending on what part, like what scope. What scope? If you're just a member of the ACP, that's great, but probably not super high yield. But if you're part of the student council of the ACP chapter in Saudi Arabia, then maybe makes it's a little better. Um, okay. Can I have access to today's PowerPoint or recording of the meeting? I'm definitely happy to do that, and I'm sure Ismail, Ala, and the rest of the team will help circulate it. Thank you so much. Interesting. Thank you so much to you. So Dr. A is saying, should I mention awards about high school academic performance? Yes, please do it. Especially if you think it's useful. Um, Again, I got a message about recording of this session. Yes, it will be circulated, hopefully. What new additions to the CV are worth notifying programs after submitting? Okay, this is a very, very important question. What new additions in the CV are worth notifying programs? So whenever you have a reason that to you is a big deal, that is the best excuse for you to contact the programs. And always, whenever you have a chance to contact the programs for a good excuse, rather than just bothering them with, hey, please look at my application, is always good. Okay, so one of the most noteworthy ones would be step 3 score would be now that, oh, I'm now ECFMG certified. Another thing would be I submitted an article, but more so I published. I already have, made it to, I published this paper. But another thing, apart from these, to be honest, I can't think of anything specifically worth notifying. And remember one thing, before I forget, you cannot update your CV after you submit. Okay, you can always update your personal information, which means your current location, email address, I think, maybe mailing address. You can always update probably your photo for some reason. I'm not sure about that one, but more importantly, your personal statement. You can always update your personal statement, and you can always update your personal information. But you cannot change anything in your CV, meaning the work experience, the research experience, and volunteering experience. So make sure you do these, do the best on these, and review them a million times. Like literally proofread every single thing a million times. Extremely important. Print it out. Get a paper and a pencil. Print it out. Get a pencil. Read it multiple times on multiple days on different times of the day in different positions, and get a pencil. Underline. Trust me. Even after all of this, you're gonna find typos and sometimes grammatical errors that you're gonna really regret later. That happened to me personally. So yeah, I'm sad that I have some of these mistakes. So whoever said they want to email me, absolutely go for it. I'm going to drop my email in a bit. If I'm working as a service IM resident somewhere outside the US, non-training position, should I and how do I approach it on my CV during the interview, please? Yeah, absolutely. I mean that is a very good experience. It's a very good clinical experience that is really beneficial to put on your CV. Okay, because one of the best things we can do when we're applying to a clinical training job is clinical work. Okay, so be sure to put it there, highlight it, and make a big deal out of it. Word it in a way that you're showing off how good it was. Um, During the interview, you have to be very honest and clear about it. That I've accepted this position because I believe I figured that this is a great chance for me to stay in clinical touch, to stay abreast with the latest clinical management protocols, and stay in touch with patient care, things like that. Although it's not a training position, I still found a lot of value, things like that. Okay. Um, okay. Let's see. What if I have no publications? So someone was asking me directly. Jennifer is saying, "What if I do? Um, can you can we put it in our research work or case reports if it haven't been published? So if you don't have publications, that's okay. Just put it in research experience. Okay, and say exactly how long were you working on, not how long, sorry, what you worked on exactly, what were your duties, what you learned about it, throw in your personal reflection out of it. That's good. Someone was saying how many pages was your CV. You really don't want to know, and that's exactly why I said I almost got questioned. So what, but I regret it, so please avoid that mistake. What's the average to include, for example, if I have no idea how many I should add? I'm not sure if I understood this question, but yeah, let me see if you can clarify it later on. Do honor rolls, graduation with distinction, rank top percent count as medical school awards? Absolutely, yes. They do. So you can say graduated first honors. You can say graduated at top 5%, 10% of my class. Absolutely, and these things should also be reflected in your MSPE as well. Should we mention our red flags onto personal statement or just leave it through the interview? We should, honestly, it's up to you. But if you really feel like you want to address why you failed CS, for example, not you, if you feel like you want to address why you failed your CS exam, because a lot of people do, by the way, um, do it. Do it only on condition you want to talk about how that helped you become a better doctor. That's the only fair situation where you would go and bring it up. Okay, I wouldn't bring it up otherwise. Okay, if I were in your shoes, okay, I would not bring it up. But I would only bring it up if I felt that failure really made me a much better doctor, which it definitely probably would have. Um, but put it in that context. Okay. Other than that, please don't bring it up yourself during the interview. At least that's definitely a no. I know many of us might go into the interview. We have some insecurities, and that's okay. Trust me, it might be the biggest thing in your life, the biggest problem that you're worried about. It's probably the least of the concerns of whoever is interviewing you right now. Okay, they know that everyone has some kind of deficiency, some kind of shortcoming. That's fine. If they bring it up, yeah, sure, prepare a good answer, right? Prepare a good, well-formed, confident answer. Okay, don't be like, oh my God, I'm so sad about that. It's such, I don't know how that happened, and don't play that game. Be confident and tell them this is what happened. Not proud of it, but I worked on it. Proud of the outcome, something like that. Um, what if you have no publications? Where can you put it in research and case reports hasn't been published? Again, I like we said in the research experiences. Any suggestions about completing the experience section of the supplemental application um, for IM? Completing I'm not sure what that is. Experience section. Completing the experience section of the supplemental application for IM. Um, I'm really not sure. Almost all of my volunteering experiences are in MSA events, which can be a bit repetitive, lackluster. How do you make these experiences sound more impactful? Interesting. The way you title each one of them, okay, um, will make it sound better. So here's the thing: some experiences are much better than others in the MSA. Okay, so pick wisely. Pick the things you wanna highlight wisely. So if there was one experience that you were just helping out in the graduation event, which is amazing, by the way. We can't graduate without people who volunteered, but and you have a couple of similar experiences, like helped arranging graduation event, help arranging the convocation ceremony, you helped arranging some kind of logistic work in some conference that's happening. Don't mention all of them. Just be picky about the ones that are most impactful, word it in a nice way, use the terminology that really is like buzz terms to make it sound like a big deal. um, so someone is asking me privately, apologies if you answer this, but do preceptors usually mention if the USC was an elective externship observership in the LORs? um, a lot of times they do not. A lot of times they do not, and if possible, let's say it's the worst type out of these and it's just an observership. I would rather have them just write the word rotation and be ambiguous about it. Okay, and that way, at least it doesn't, tone down the experience, because a lot of times the experience is way more than just observing. The experience is much more bi-directional teaching and things like that. So if you get the chance to help in writing that or help formulate, the ideas that are going to go there, just rotation is good. But yeah, again, a lot of times we don't know what they're going to put in there, so that's why do consider not waiting if you really feel the need to. If I have an abstract and got accepted and I will present in November, can I mention both publication section and presentation? Um, so I don't. I'm not sure if presenting an abstract is considered a publication. It's probably a presentation. Um, or am I wrong about this? What are the average experiences you should include under each experience, in your opinion? I don't think there's an average, to be honest, or even if there is an average, statistically speaking, I don't think there's a right or a better number. It's just about how important, how impactful each of these are. Okay, that's really important. Um, just be deliberate. Just be deliberate about what you're picking. Usually, the shorter the better. To be fair. Um, but let me tell you this: a lot of people I know had their whole application. Mm, some people are like 6, 7 pages. Some people are 10, 12 pages. Just to give you a range idea, the 6, 7, 4 pages might be better than the 10, 12 pages. The 10, 12 pages might be better than the 4 pages. So you do you have to think about it and see what makes sense to you. Okay, you have to just put yourself in their shoes for some time. And I gave you the context. A big program that has more than 50 seats might literally get 7,000 applications, from which they might interview 700 and eventually pick 50. Okay, so just so you know how much time they have. So some people are asking about my email. I'm gonna put it down in the chat. Thank you so much. Um, helping out in uni events can be mentioned. If yes, in what category? So yeah, you can. It's going to be in volunteering for sure. Someone is asking, should I address a score drop in person statement? Step 1, 260, step 2, 240s. Do not address it. Okay, do not address it. And this is way more common than you think. And it's okay. Congratulations, these are great scores. Definitely do not. You don't need to address it, because it's still a fantastic score on both. And even if it really was a big drop, say if someone got 30 points or so lower on step 2, that also means they dropped a couple of percentiles, big amount of percentiles. It's okay. I would say it's okay. So someone is saying, I won award in fact. And by the way, for the person who asked about that drop in score, no one is going to ask you about it. I know a couple of people who did have that. No one's going to talk about it because they're still amazing scores anyway. Congrats. I won award. Someone said I won an award in fashion and also won a beauty pageant. And don't know if it's appropriate to add. Honestly, it's probably very appropriate to add. I would do it. I actually have a friend who also, okay, you're not the same friend. Okay, so I'm just double checking. I also have a friend who is very involved in some beauty pageants and things like that, and I think she did include it, and it was a good idea. So definitely do it. My uni has hardly any societies. What should I do? Um, I mean, that's okay. That's okay. You can go out to the and get involved in community events. And I don't know where you live, but other universities might be also very happy to have you. I know my university will take you with open arms. In Alfaisal University, I'm sure they're going to be very happy to have you volunteer. Just reach out to some of us or someone working there and in the Medical Student Association. And you can get involved, especially if you're applying. Not this season and you have some time. So you can work on it from now. Is it better to say clinical assistant of clinical extern? If you mean clinical assistant or clinical extern, I would say clinical extern, because we're not assistants. We're more than that. I don't have much US experience. How much worthy is it to go for a telerotation? I mean, look, it's something better than nothing. People matched with telerotations. I think this time is very special. People have done telerotations, have done nothing sometimes. Just home you like home LORs. So might as well just throw one US rotation in the mix, right? I'm not going to say it's extremely helpful. Because end of the day, they know it's not hands-on. They know it's all virtual. So it's not necessarily real US clinical experience, but at least it's something. So it's not very worthwhile, but it's good. Better than nothing. So an easier way to put it, if you have three actual in-person experiences or four actual in-person experiences and four telerotations, don't put a single telerotation. That's how I would put it. But if you don't have any, yeah, I would definitely put one or two. Don't spend more money than one, to be honest, on telerotations. Please, can you throw some more light on the difference between categorical and prelim internal medicine programs? Okay, real quick, categorical internal medicine program means you're going into an actual 3-year training in internal medicine. Prelim internal medicine means that you're going into neurology, or you want to go into dermatology, you're going into potentially radiology, ophthalmology. These two specialties, they can pick between a prelim surgery or a prelim medicine. So anyway, if your goal is to go into internal medicine, then prelim is not a good idea. You need to apply for categorical. In very certain special situations, in some special programs, they might consider you for a prelim internal medicine, knowing that you want to end up in internal medicine. Prelim surgery is very different. Prelim surgery, for people interested in surgery, it's a very, very well taken route for international medical graduates. They do prelim surgery and then enter actual categorical surgery by reapplying again. And if the odds are in their favor, they'll make it into surgery. Prelim medicine is usually not to medicine. Just remember that. It's usually to some other thing like neurology, like dermatology. So it's mostly USMDs who take this route. So someone is saying privately, if you've done the same volunteer work on and off for several years, how to indicate the dates and clarify that. It's really up to you. It's really up to you. So you can really put the whole spectrum. Say I've been doing this from 2016 till 2020, and so like put the dates from 2016 to 2020, and then kind of clarify. I would do this on and off. In a more proficient way. All right. Someone is saying, what should I write in the organization name, their work experience? If I rotate in a clinic that is a hospital affiliated, also, what should I be writing in duties? Okay, okay, that's one of the direct messages I got. So if you worked in a place at a clinic that is hospital affiliated, So honestly, if it was a considerable amount of time that you worked at the hospital with that particular physician, you might mention the hospital's name, as long as you put it fairly and you're not lying, right? So in the actual description, you mentioned that you were working with so and so doctor in their private clinic, and this doctor had admission privileges to so and so hospital, and you would go on with him every day or so to their with him or her to the hospital, round on all their patients, do this, do that. I think in that case it would be pretty fair to put the name of the hospital if you want to. Okay. So again, the question also says um, what should I be writing in duties? So you can choose what you want to write in your duties, but again, try to reflect. Try to do some reflection on your duties. Okay, that's very important. Don't just list them out. That's my main message. If U.S. experiences was with Arab doctors and thus LORs is Arabic, is that a concerning? No, it's not. It's not going to be concerning to program directors if the letters of recommendations are coming from doctors of specific ethnic backgrounds. No, but I mean, if you feel it's concerning for you that you want to show that, oh, I've worked with different kinds of doctors from different kinds of training and ethnic backgrounds or things like that. Sure, you can be a little more picky with who you're doing rotations with, but it really shouldn't be a concern, to be honest. Generic US LOR is another specialty, not my interest, vs a good home LOR in a US from a US trained physician in my specialty of interest. So the same person has two US letters and a chair's letter. Just wondering about the fourth one. Um, so either a generic US letter in another specialty or a good one from your home. To be honest, it's a tough choice. Maybe I would go with the good home LOR, since it's just one LOR that is from home and the rest are all US. And this home LOR is by a US trained physician, and if it's more personable, talks about you more, then maybe that's a good idea. Okay, to put it, versus US letter that's generic and from another specialty, maybe not super helpful. But the good news is it's not going to go in vain, right? You can use that specific other experience you had and put it in your work experiences. You don't have to have it only in your, it doesn't have to be in your LORs. It can still be in your work experiences. So don't worry, it didn't go to vain, right? It didn't go in vain. Um, Another direct message saying, I have one paper published by a predatory journal. I'm not sure what that means. And decided to not mention it. I have like other 8 publications. Should I still include it? If it's a predatory journal, whatever that means, don't mention it. I'm sorry, I'm not sure what that means. Um, so do we add electives that we did locally that are not specialty specific? For example, I took a psychology elective on cognitive behavioral therapy. Why not? Honestly, why not? That's actually very cool. I would do it. Um, Someone is saying he has a similar question. What if that generic US LOR was from the specialty of my interest? Would that change the answer? Um, so if you also have another competing letter from your home-based institution, but at least the US generic LOR is from your specialty of interest, um, it's also still hard to say, but it depends. It really depends. If it's a good institute here in the U.S. that's writing you that letter, then yeah, maybe you want to put it here. On the other hand, if the home LOR you have is the only home LOR and the rest are all good U.S. letters, might as well have put one home LOR in the mix. One more time, you're not missing out on that. It's not going in vain. That generic LOR's experience. You can still put it in your experience and pump it up as much as you want, as long as you're honest. Put it there, make a big deal out of it, and it's okay to not put its LOR. If you feel like you don't want to put it. So another direct message saying, would doing a U.S. clinical experience and obtaining an LOR from a general internal medicine ICU program or a specific specialist of interest be greater value if you're applying to internal medicine? It's up to you. So you can put a specialist LOR, or you can put a general internal medicine LOR. If you have both, you can pick whatever you want. If you're still in the process of choosing which rotation you want to go for, I would try to go with the more general one. I would try to go with the more general, broader one, like general internal medicine, ICU, blah blah blah, rather than a specific specialty. But again, we don't always get to be very picky. So if you get a specialty, that's even amazing. That's fantastic. Will the work experiences on my but if, by the way, just to finish that loop, if you already did both and you have both LORs and you're trying to pick a specialty versus general internal medicine, pick the stronger letter, full stop. Pick the stronger letter, or the mix between stronger institute and letter. So will all the work experiences on my ERAS application be submitted to all programs? Yes. Or may I choose which programs to see which experiences? That's the thing. You cannot pick and choose. You cannot tailor what in the work experience goes where. Everything in the work experience goes everywhere. I know it's not the best, especially for people who are doing multiple specialty applications. Sorry to tell you that everything in your CV, meaning work experience, research experience, volunteer experience, is going everywhere. What you can tailor is your LORs. What you can tailor is your personal statement. You can have multiple personal statements that you can assign one to every program, and it can be different for each. You can have different LORs assigned to different programs. But remember, once you assign an LOR to a program, you can't take it back. You can't change it. For some reason, you can update the personal statement, but at least the last time, but you cannot change the LOR. So be sure what you're assigning where. Okay, so here's an explanation of what predatory journal means. It means they basically stole the article and published it in a non-indexed online site. Oh. I would stay 6 feet away from that. Be careful. I would not. I would definitely do my best to not have any association with that. Okay. So you were saying one paper published by predatory journal and decided to not mention it. Yeah, definitely don't mention it. So did they steal your work? But anyway, try to stay away from this mess, okay? Regardless what it is. And you're saying you have 8 other publications, hopefully good publications. So best of luck. Put the good ones, the clean ones. How does the chair? I'm pretty sure it's not your fault, but yeah, I know what you're saying. So how does the chair letter differ from other clinical letters beside the letter writer? Is it the content? Is content? I'm not sure if the content is supposed to be different. It's just that for some reason there's a check mark box that says if this is from chair department or whatever, just check this box. Maybe it holds a little more value to the readers, to whoever is reviewing the application. They just want to know, they want it to light up and pop up, okay, this is written by a department head. So I want to definitely look at this one if I'm picking 1 out of 4, 2 out of 4. So I think the content would be very different. It's just that you have to tick that box, okay? You're welcome, Khalid. Maya is saying thank you. You're most welcome. Thank you to the organizers, definitely. You guys are most welcome. Anas. And then Hashim, I think, is asking, Noor is asking. Someone is asking on a private message, does evaluation papers during internship have any impact on the applications? Absolutely not. So evaluation papers in your internship or in your medical school will not show up, okay, unless in the MSPE. So I don't think it has to do anything with your ERAS application because there's no place for you to put it unless it's in your MSPE for some reason. Usually what's in your MSPE is your clerkship years, meaning 4th year and 5th year and not the last internship year. So if anything, an evaluation in your 4th and 5th year might be detrimental, but to be honest, I don't think anyone has like a crazy bad evaluation that whoever's writing your MSPE really will incorporate it. You know what I'm saying? So don't worry about it. No. The answer to your question really is no. Okay? It's not. These evaluations won't impact your ERAS application. So Hashim is saying when applying for clinical electives for internal medicine residency, should we aim for general internal medicine electives or subspecialty? So I answered this, spoke to about this a little bit. So if you have the chance or if you have the choice, I would go with general stuff. So general surgery if you want surgery, general internal medicine if you want internal medicine. But sometimes we don't get to choose. If you have a if a subspecialty is available, then go for it. Why not? Even if it's not necessarily the specific subspecialty of your interest, it's still internal medicine, so go for it. But yeah, I would go with general first. Um, so someone's asking, how did you apply for electives directly through the portal, or did you contact the faculty? There are many ways to do this. Okay, there's so many different ways to do this. You can, if your school participates in VSAS, which is the Visiting Student Application Services, you can use that. If the school participates in GHLO, Global Health Learning Opportunities, or something like that, you can do that. You can go on their specific websites of specific schools that you've heard, or can search and look up who's offering electives. Unfortunately, it's very hard now with COVID and pretty much everything shut down, and I think they still are. You can go to their direct website and apply or email. You can also, if worst comes to worst, you have to arrange. That's the last resort. You have to arrange some kind of experience with a private physician. Then either reach out to people like doctors here in the U.S. through family, through friends, neighbors, whatever. Or again, worst case scenario, you can use one of these agencies, one of these commercial agencies. Unfortunately, they can be a little expensive. We'll charge you a couple of $1,000s to get such experiences, but it's exactly the same experience that you can get with a physician who you'd ask on your own. Okay. Um, and what Reina is saying is very correct. They'll typically include. So that's to that's in response to the question about MSP. I mean, about evaluations. Yes, MSP will typically put the positive stuff in your evaluation. So I do agree that most of the time we only have very positive things. So should I go directly for a residency or do a year of house job before applying? Well, depending on your goals and if you're ready to apply. If you're ready to apply, I wouldn't delay it. If you're not ready to apply for whatever reason, I would do something very useful during the delay, like for example a house job. Okay. If you're ready and you still want to do a house job for other reasons, then sure, do for whatever reason. But if you whenever ideally when you're ready, go for it. Patty is saying, which is better, a US LOR I got from a month of internship, or a local LOR from a research mentor who I worked with for 5 years and knows me very well? I wouldn't choose between these two. I would put both of them. I wouldn't choose between these two, because someone who worked with you for 5 years, knows you very well, will write a very personable statement, a very personable letter for you. I would want them to have that letter in. And a US LOR month of elective or whatnot. Yeah, definitely put that too. Okay. You're most welcome, Marwan. I'm very happy that you found this very helpful. Um, yeah, I understand, Fadi. You're saying it's a research LOR. That's fine. That's fine. As long as it's just one out of the five, it's fine. Okay. Um, you're most welcome, Yoon Hee. And if I think I tried to answer most of the questions here. And if anyone has any more questions, feel free to email me. And this is my email. I'm going to put it here in the chat like I as promised. Michelle, you're most welcome. So feel free to email me any questions. For the sake of time, probably we have to end this session. I'm sorry for going over. And again, thank you everyone for attending, and I wish you all the best of luck. I think you're going to do fantastic.
Yeah, so thank you, Dr. Marwan, again, so much for this helpful presentation. Everyone seemed to enjoy it and benefit from it, so thank you again.